aside, you know, a few tables at a time to do the lymphatic chart when I pull that down after I get my notes. So let's start with the respiratory system. So the middle of page 24. Respiratory mucosa, that would be a question. It's the mucosal membrane that surrounds your respiratory tract, so in your nose, down your pharynx, your trachea, and through your bronchial tubes. So that would be a question. So the epithelium that surrounds your respiratory tract. Your nose is right there. The nostrils are, you know, the part of your nose that you would get pierced, usually, if you get your nose pierced. The vestibule is just inside your nostril, so as you start to pick your nose, you go in through the vestibule, that would be the space. And then the nasal cavity is if you went really far and went way up there, so that would be the space way up higher. The nasal septum is not on here. There is a picture on APR that has the nasal septum, but it's the piece of tissue that separates your nose into two halves, and you can see it if you look at yourself or at someone from the front. That little dividing line in the middle of your nose, that's the nasal septum, and it covers all through here, so it separates your nose into two halves. And then the nasal concha are these bones that stick out into the nasal cavity. There's three of them. Remember from AP1, the superior nasal concha, middle nasal concha, and the inferior nasal concha. That's that. Your mouth is right there. The oral cavity is the hole in your mouth, so your big mouth space. Your tongue is the big thing right here. And then the lingual tonsils, that's this piece kind of sticking off the back of the tongue. That's the lingual tonsil. The palate is the roof of your mouth. It's bony in the front, and it's called the hard palate there. It gets made of connective tissue, the bone ends, and now it's just connective tissue in the back, and that's the soft palate. So hard palate, soft palate, and then the uvula is the bottom of the soft palate, and you can see that if you look in the mirror and open your mouth, it's that little hangy ball in the back of your throat. That's your uvula. The pharynx is the tube that goes behind your nose, behind your mouth, and then leads down to your larynx, which is this tube, which then will go down to the trachea. It's divided into three sections. The nasopharynx is where it's behind the nose, and in the nasopharynx you find the opening to the auditory tube, which is this hole right here, and that heads out to your ears. And then the pharyngeal tonsil, which is this orange blob at the top of the pharynx. Then we follow the pharynx down, and now the pharynx is behind the mouth, and that part of the pharynx is called the oropharynx. And in the oropharynx, you'll find the palatine tonsils, which is this orange blob right behind the lingual tonsil. And then below that, we have this last section of the pharynx, and that's the laryngopharynx, and it's right behind the larynx, which is this. Now, the larynx we can see on this model, and then we'll also have this model here, which is just a giant larynx. So we'll do both of them. I'll start with this one. The hyoid bone, this white bone at the top here. So right at the top of your neck. The thyroid cartilage, that's your Adam's apple. That's this blue stuff right here with the number 2 on it. Roman numeral 2. Cricoid cartilage is right below that. So this is blue right here. And the arytenoid cartilage, you can't see on here, but it's in the back. It's little. We can see it on this other model, so we'll get to that in a minute. The epiglottis is this piece of tissue right here, and it has a Roman numeral 1 on it. It's blue, and it's actually a flap, and it covers the larynx when you swallow food, so the food will go down your esophagus, or water, anything that is a solid, anything other than air. The glottis is the space, so it's seen as a slit here in this model. The true vocal folds and the false vocal folds or vocal cords. The true are the little white stripes right around the glottis on either side, so they're the most medial ones. And then lateral to those your hyoid bone at the top, big white thing, and it looks like it has these little teeth sticking up out of the top of it. The thyroid cartilage is the giant gray piece that makes your Adam's apple. The cricoid cartilage is the gray just below. And then if you turn it around to the back, you see these things that look like kind of spider claws right here? These are the arytenoid cartilage. So they look like little claws and they move. The epiglottis is this thing. You can bounce it on this model, and it covers the glottis, which is the space. So it's the space here. Now, I never actually asked the glottis on these things because they're kind of broken in here. We have vocal cords and false vocal cords, but they're broken too. So I never asked them on here. I'll use the APR or the other model that I just showed you. Now, under the cricoid cartilage, we have the trachea. And then we have tracheal cartilages that are these gray rings all the way down the trachea. And that leads to the lungs.